think of in my head when I'm examining that patient. And also what we'd like in terms of awareness is to create awareness from the patient. So when they're in that room and they're over 40, doctor, what does my disc look like today? And then I would like to encourage that GP, if he's not sure, to buy a camera. And I think it's, if you're a group of GPs, you should have a fundus camera, and one that you don't need to dilate eyes with, and photograph all your patients. And you can put them on, digitally store them, and look at them, or send them to your colleagues, your specialist colleagues, to look at them. But I would think if we're going to a primary healthcare system, we need to do more recording, objective recording of optic nerves, specifically in our case, but also retinas, looking for hypertensive changes, and also picking up incidental disease, because we have patients who, we had here, the gastroenterology prof sent us 10 patients last year to screen for just general disease because he was concerned. They were working in the radiology suite and they were being exposed to radiation. In that group of 10 that came down, we found one patient with raised intracranial hypertension, which is raised pressure in the head, which was detected just by looking. All right? So now if the GP had photographed that disc and sent it to a specialist, he would have seen papilledema. And again, an asymptomatic disease but picked up by screening. So if you say to your GPs, this is what you should do, organize yourself, get people who are screening for you in a sort of in a primary healthcare clinic to take photos that are then looked at. And India is very big at this. They have satellite clinics. They go out and they're not even, they may be healthcare workers who are able to take photos. And when they look at them, they screen them. Optometrists on the, or trained primary healthcare workers look at the pictures. And then things that they're not sure of, they refer by satellite back to the sort of the base hospital, and then specialists look at that disease. And that's not only back of the eye disease, that's front of the eye disease, corneal pathology and other. So that's technology that doesn't cost a lot of money. Once you've done the investment, it works very well. So I would suggest that telemedicine, as it's called, is a good way for us to go here in this southern African area.
Thank you very much.
Good.